Right. So we were actually discussing about the gout, okay, which I told you, in which I told you, okay, these occurs due to monosodium urate crystals, fine deposition. Acha. So history and physical examination, when we will see how these patients actually present to you, presents with sudden onset of excruciating joint pain, right? So there will be excruciating joint pain, okay. Gout is associated with erythema. What is erythema? Erythema is basically the redness at the site of the inflammation, okay. Erythema. Warmth. Why? Because there is increased blood supply, and blood is actually, it is actually has high temperature, right? So that is why that area will be warmed, okay. And there will be swelling, fine swelling. Why? Because there is increased vascular permeability during the inflammation, and blood content, especially the fluid, it will leak in the site of the inflammation, right? So there will be swelling and decreased range of motion. Patient won't be able to, for example, move, okay, the joint. So the next is the fever and mild leukocytosis can be present, fine. Fever, obviously it occurs due to the when there is production of the interleukins, there are different types of cytokines, okay. They will go into your hypothalamus and alter the temperature there, okay, fine, during the inflammation. So that will lead to fever and mild leukocytosis, as I told you, okay. When there is inflammation, obviously the white blood cells will also be there, right? Okay. So that will increase the, yeah, there will be leukocytosis, okay, fine. So we have disorder of the gout, okay, which occurs due to uric acid. History, it is more common in the male sex, okay. Binge drinking, right? Binge drinking, whatever you want to pronounce, okay. Binge drinking, basically it means the people, do you have you seen actually the chain smokers, the people who, they smoke cigarette, and after, right after one cigarette, okay, they will start smoking the next cigarette, and when that finishes, then they will start the next cigarette, okay. So that basically they are called as the chain smoker. They never stop smoking, okay. At a time they will smoke like 5 to 6 cigarettes, okay. So अब ये जो binge drinking वाले patients होते हैं, ये क्या होता है कि they will start drinking alcohol, okay, and they really drink a lot of alcohol. एक ग्लास पीने के बाद दूसरी ग्लास, तीसरी ग्लास, चौथी ग्लास, fine. So they are actually called as binge drinkers, okay. So alcohol is not very good, okay, for our kidneys, for our, you can say, liver especially, right? It will cause fatty liver. Right. So recent surgery, okay, and hyperuricemia means increased level of the uric acid in the blood. Acha, joints affected. First, big toe, which is also called as podagra, okay. When your big toe, it means when your first metatarsal joint is involved due to the gout, okay, right, hyperuricemia, that is called as the podagra. And other joints also can be involved. Acha, up crystal shape, needle shape, okay. What type of the, for example, shape the uric acid monosodium urate has? It has needle shape, okay, fine. Achha, here are some pictures, okay, right, like this. Here are some pictures, fine, okay. Right, now listen very carefully. We'll discuss about these. 80% of the cases are monoarticular, right? It basically means 80% of the cases are monoarticular, okay. It affects one joint, okay, one side, fine. Gout most commonly affects the first metatarsophalangeal joint. Okay, first metatarsophalangeal joint, I told you, right? Here is especially, right? First metatarsophalangeal joint. Okay, and the midfoot, knees, ankles, and wrist. Okay, I told you these things. The hips and the shoulders are generally spared. It basically means hips and shoulders are mostly spared. They are not affected. Okay. Now the next thing which is very important, that is toffee. This is another terminology. Okay, toffee. What is toffee? It basically means urate crystals deposit in soft tissue. Okay. So far we discussed कि ये जो हमारे पास uric acid के, for example, जो uric acid monosodium urate crystals, right? They normally deposit into the joints, but they also can deposit into the soft tissue, fine. And that is actually called as the toffee. Can be seen with chronic disease and are associated with tissue destruction, right? So toffee are visually pathognomic for gout and are panless and non-tender, right? They can ulcerate and discharge a chalky white substance. Can you see this? It is actually here, okay, fine. ये है सॉफ्ट टिश्यू के अंदर क्या डिपॉजिट हुआ है? मोनोसोडियम यूरेट क्रिस्टल्स, ओके. यूरिक एसिड, kidney stones are seen with chronic disease, right? So sometimes we also can see uric acid kidney stones. Okay, so diagnosis. What do you do in the diagnosis? You will do joint synovial fluid aspiration, okay. You take out the fluid from the joint, because septic arthritis can present similarly. अच्छा, septic arthritis वाले जो patients होते हैं उनमें भी यही symptoms आते हैं. Okay, find reduced for example decreased range of motion, swelling, warmth, erythema, fine, and very severe pain. So you have to rule out septic arthritis also in that case. तो जब आप synovial fluid aspiration करते हो, so at that moment आप septic arthritis को भी आपने rule out करना है. Okay. Aspirate shows needle shaped negatively birefringent crystals, right? अब जब एस्पायरेशन करते हो, एस्पायरेशन फ्लूइड एस्पायरेशन करने के बाद उस फ्लूइड के अंदर आपको क्या मिलता है? नीडल शेप्ड नेगेटिवली बायफ्रेंजेंट क्रिस्टल्स आपको मिलता है. ओके, इफ इट इज गाउट, राइट? ओके, अगर ये गाउट ना हुआ, सो ऑब्वियसली दैट कैन आल्सो बी सूडो गाउट. ओके. लैब टेस्ट शो, लेब टेस्ट एंड इमेजिंग जब आप करते हो उसमें आपको क्या मिला? सीरम यूरिक एसिड इज यूजुअली एलिवेटेड more than 7.5 milligram per deciliter, but patients may have normal or even decreased level during an acute attack of gout, right? अच्छा, इसमें और क्या चीज़ मिलती है? एरिथ्रोसाइट सेडिमेंटेशन रेट एंड सी रिएक्टिव प्रोटीन, राइट? ओके, आर टिपिकली एलिवेटेड, and joint fluid aspiration and analysis are required to clarify the diagnosis, right? So ESR and CRP ये normally, for example, ये elevated किस वजह से होते हैं? Due to the inflammation. Okay, they are actually the sign of inflammation. Okay, so these are the findings. But if for example you are not treating the patient, if these patient goes into the advanced cases, then at that time when you will do the x-ray, what type of finding you will find in the x-ray? It will show punched out erosion. Okay, punched out erosion with overhanging cortical bone, red bite erosion. Fine. So these red bite erosion will be the finding in the gout patient. Okay, right? Especially in the advanced cases of the gout, right? And here are actually few causes of the hyperuricemia, right? Increased cell turnover जैसे कि hemolysis, blast crisis, tumor lysis. Okay, tumor lysis I told you कि जब हम chemotherapy देते हैं. Fine. Myelodysplasia, psoriasis. It can also occur due to some drugs जैसे कि cyclosporin. Okay, diuretics, especially thiazide diuretics, low dose salicylates. Physiologic states जैसे कि dehydration and starvation and obesity. Fine. Disease, diet, or lead poisoning, Lesch-Nyhan syndrome, yeah, salicylates, low dose. So these are few risk factors, okay, few causes of the hyperuricemia that you have to remember.